A flawlessly restored dental arch is the result of a specific biological sequence that extends far beyond the day of surgery. The All-on-4 protocol requires a progression of physical healing and strict medical adherence. It is a functional restoration rather than a cosmetic surface change. While a set of temporary teeth is attached on the day of surgery, this is only the starting point. Achieving a final, permanent restoration requires a 6-month commitment to the healing process. Eligibility for this procedure depends on specific health markers. You must have a functioning immune system to support bone growth, and you must adhere to a strict soft food diet to avoid disturbing the implants. Medical data identifies tobacco use as a primary risk factor for procedure failure. Smoking constricts the blood vessels, restricting the oxygen flow required for bone repair, and increasing the likelihood that the jaw will reject the implant. Long-term success is not determined solely by the initial surgery. It depends on your body's biological cooperation over the next 6 months. The process begins with 3D CBCT imaging to map your jaw. CBCT, or cone beam computed tomography, is a specialized X-ray that provides a 3-dimensional model of your existing bone density and nerve locations. On surgery day, failing teeth are extracted and 4 titanium implants are anchored. 2 vertical implants go in the front and 2 angled implants in the back. This tilted geometry maximizes bone contact, bypassing sinus cavities and preventing bone grafts. Once the implants are anchored, the immediate loading phase begins. A temporary acrylic bridge is fixed to the implants, providing functional teeth before you leave the clinic. This acrylic bridge acts as a rigid splint. It keeps the implants perfectly still, allowing the underlying bone to begin the fusion process without being disturbed by movement. Days 1 through 3 involve the most significant physical recovery. You will experience peak swelling during this window. Managing this requires keeping your head elevated and applying ice packs in 20-minute intervals. For the first 72 hours, a strictly liquid diet is mandatory. Cold broths and protein smoothies provide nutrition without jaw movement or force on the surgical sites. You must avoid using straws during this period. The suction required to use a straw creates negative pressure that can dislodge the blood clots protecting the surgical sites, leading to infection or stalled healing. It is vital to distinguish normal recovery from surgical complications. While bruising is expected, you must contact your dentist immediately if you develop a fever, notice pus at the surgical site, or if swelling increases after the 3rd day. Adhering to these protocols during the first week is a tactical requirement. It protects fragile tissue from mechanical disruption and limits the risk of infection. Between months 2 and 6, your body undergoes osseointegration. Osseointegration is the biological process where living bone tissue grows into the surface of a titanium implant, creating a permanent structural bond. On a microscopic level, bone cells multiply and wrap around the threads of the implant. This fusion creates the stable foundation necessary to support chewing. By the 3rd week, patients typically stop feeling pain or swelling. However, beneath the gums, the new bone tissue is still forming and has not yet hardened. The jawbone remains uncalcified at this stage. Biting into hard or crunchy foods generates forces that can shatter these microscopic bonds, leading to the total loss of the implant. During this healing phase, transition to a soft food diet. Meals like soft fish and well-cooked pasta provide necessary nutrients while minimizing mechanical stress. The deciding factor for long-term success is patience during this cellular fusion. Respecting the timeline allows the bone to reach full density. At the 6-month milestone, your dentist uses radiographic imaging to confirm that the implants have completely integrated with your jawbone. Once stability is verified, the temporary acrylic teeth are removed. These temporary teeth have fulfilled their purpose as a shock absorber during the healing phase. The final step is the attachment of the permanent bridge, often crafted from monolithic zirconia. Monolithic zirconia is a high-strength ceramic material that provides natural aesthetics and the durability to withstand long-term chewing forces. This final bridge is a permanent biomechanical extension of your anatomy, anchored securely in place by the fused implants. By adhering to the 6-month timeline, you have replaced failing teeth with a fixed arch that replicates the function and appearance of natural teeth. Longevity requires a new daily maintenance routine. You must use a water flosser to remove bacteria from the space between the prosthetic and the gum line, as traditional flossing is often insufficient for this design. While the bridge itself cannot develop cavities, the living tissue and bone supporting it require professional monitoring. Biannual checkups are necessary to ensure the gums remain healthy and the implants remain stable. The All-on-4 journey trades 6 months of disciplined recovery for decades of restored function and the preservation of your natural jawbone structure.